Good afternoon. I'm here today to provide an update on Alberta's restriction exemption program and on COVID-19. Alberta is doing good work to close in on the national vaccination average, with more than 85% of eligible Albertans having received first dose coverage. That's up from 78% just over a month ago, which means that over 250,000 Albertans have stepped up to get at least a first dose of protection. And to them, I want to say thank you. Altogether, more than 3.2 million Albertans have decided to protect themselves, their loved ones, and our healthcare system. You are making a difference with those choices. In fact, Alberta has moved from being about 10 points behind the Canadian average for first dose coverage to within 2% of the national average. I also want to thank each and every Albertan who followed the gathering limits this Thanksgiving weekend. While we still have a ways to go, we are seeing some encouraging trends, which means that the restrictions exemption program, together with other vaccine incentives and public health measures, have had a real and positive impact. Every Albertan who chooses the protection of vaccines is one less person who might end up in our intensive care units or hospital beds, which means less pressure on our system. We're still facing cancelled surgeries, and ICUs are well over their typical baseline capacity, which means that there is less care available for people with other pressing medical needs. A COVID-19 vaccine is the best way to ensure that there's a bed for you or your loved one if they have a serious medical issue like a car accident or a heart attack. To put it bluntly, there are currently 1,053 Albertans hospitalized with COVID-19, and 73% of them are not vaccinated. And from those 1,053 in hospital, 242 Albertans are in intensive care with COVID, with almost 90% of them being unvaccinated. Vaccines work, period. Alberta's restrictions exemption program, our proof of vaccination system, is based on this basic and obvious fact. When we launched it on September 20th, it was about ensuring Albertans who choose to protect themselves and others can safely do as many things as possible without public health restrictions. That's because if you are vaccinated, you pose a much smaller risk of spreading COVID, and if you're exposed to it, you face a dramatically lower chance of a severe outcome like hospitalization or death. The numbers here in Alberta bear this out. For example, every single Albertan under the age of 40 who has lost their life to this virus has been unvaccinated. That's why today I'm announcing steps to make it easier and more secure for people and businesses to participate in the program, the REP, and to limit the spread of COVID-19. As of today, Alberta's new verification app to scan proof for vaccinations with a QR code is available for download on the Apple App Store and on Google Play. Businesses and organizations can immediately use the free app at Alberta COVID Records Verifier to quickly and easily check the authenticity of a vaccine record. Albertans can get their enhanced vaccine record with a QR code online at alberta.ca/COVID records. That's alberta.ca/COVID records. There is no need to create an account. All you need to do is enter your Alberta Health Card number. When a valid QR code is scanned, a green check mark will verify the proof of vaccination. It's that easy for businesses and Albertans participating in the REP. And it's important to note that the app does not store any personal information for privacy purposes. This new QR code verifier app is in addition to the REP implementation grant that we announced last week, which is a $2,000 payment available to businesses to help offset the costs of implementing and participating in this program. And the REP training grant is also providing funding to businesses to help train their staff on how to safely and professionally request proof of vaccination, similar to the ProServe program for alcohol service. I'm pleased to say that these new programs have made Alberta the first province in Canada to provide financial support for businesses who choose to require proof of vaccination. We're doing everything we can to ensure as many Albertans are protected from COVID-19 as possible. With that, I'll turn it over to Minister Copping to provide more details, and we'll then be hearing from Chief Medical Officer Dr. Hinshaw and AHS President Dr. Yu.
Thank you, Premier, and good afternoon. I'm glad to be here to announce another step forward in the Restrictions Exemption Program. The main goal of the program is to reduce the risk of spreading COVID-19 while enabling businesses to operate safely for their employees and their customers. It has also encouraged people to get more information on vaccines and get vaccinated, and it's working. We are still seeing far too many new cases of COVID-19 every day, but they seem to have plateaued, and I'm hopeful that they're beginning to decline. There are many factors that contribute to that, and I think this program is one of them. And vaccinations are up. The total number of first and second doses given in September was 54% higher than it was in August. And as mentioned by the Premier, we are at 85% of first doses. That's great news. And I think it's clear that the Restrictions Exemption Program is one of the drivers. So I'm pleased to update you on the next step to make the program even more effective. On September 19th, we launched a fast access website for people to download their vaccination in a convenient card format. The website was a huge success. It's been used more than 3 million times, and a typical transaction takes just a few seconds. All across our province, businesses and venues have started checking these records. 10 days ago, we took the next step, a more secure vaccine record with a watermark and a QR code. Over 800,000 Albertans have already accessed their enhanced record over the past week. And today, I'm pleased to announce another step forward, the launch of the free government-supported Alberta COVID Records Verifier app. The app is now available for download in both the Apple and Android app stores. Businesses and other organizations can start using the app right now to check proof of vaccination for patrons who have a QR code. It's fast, easy, and secure. The app does not store any personal information. It displays the person's name, date of birth, and whether the person is vaccinated. The QR code contains a secure digital signature that verifies the record, which makes it extremely hard to forge. Albertans can get their enhanced vaccine record with a QR code online at alberta.ca/COVID records. I encourage everyone to get your new record as soon as you can. You can download it or take a screenshot of it, and you can also print it if you wish. If you don't have a phone, you can get a printed version from a local registry agent at no cost. We're asking everyone to get their new record over the next month, and then, starting Monday, November 15th, the new record with the QR code will be the single acceptable proof of vaccination here in Alberta. We want to give people time to get their new record and give businesses time to make sure the process works for them. But we also want to take advantage of the security and convenience of the QR code and build on the success of our REP program. So let's take a look at how it works. So the first step is we download the app to an Android or Apple smartphone. The app you scan a person's QR code. And if you're seeing online, and I can't see it in this room, but it may be online, if you take a look, you'll see what the enhanced vaccine record looks like. It includes your name, date of birth, COVID vaccinations, and the QR code. Now, once it's scanned in the app, the next slide will show what comes up. When a valid QR code is scanned, a green check mark will verify the person and ensure that they are vaccinated. It will also display the person's name, date of birth, which businesses can then check against their ID for people aged 18 and up. The record will show as invalid if a person does not meet the vaccination requirement or if the QR code has been tampered with. Now, privacy of health information is vitally important. So to repeat, the app does not store any personal information, and it does not link to any external data. The QR code isn't a hot link to an external database or website. All of the required information is contained within the code itself. So that's it. Starting today, if you've got a QR code and a business has a reader app, you just show and go. And as of November 15, all proof of vaccination will be done with the security and convenience of the QR code. Now, this is a real step forward, and I'm thankful to the millions of Albertans who already are making the restrictions exemption program work. But of course, it's only one small piece of the puzzle. The much bigger piece is to get more Albertans vaccinated. And one sure way to get the current wave behind us and be ready for the next potential wave is a higher rate of vaccination. And we're getting there. As indicated, we've hit 85% for first doses, but we need to keep it up. I'm hopeful that the current wave of cases is passing and the pressure on our hospitals is easing. But I need to say two things about that. First, the pressure right now is just far too great. We need to push the cases down much lower and give our doctors and nurses some real relief. And second, we need to keep them down in the future. So I'm deeply grateful to our healthcare professionals who have worked day and night to help get us through this crisis. We need to acknowledge them, but more importantly, we need to act. I know some people have doubts of many different kinds about vaccinations. So please talk to a doctor or pharmacist or other healthcare professional, get good information and get good advice. And I'll say this, first, you may have heard that the vaccines wear off, so getting your shot won't make any difference over the long term. But that's simply not true. The vaccines are incredibly effective and they last a long time. Just last week, a study found that even at 6 months, the Pfizer vaccine is still 90% effective in preventing hospital admission and death from COVID. Getting vaccinated now means you are absolutely helping us get past the current wave and help prevent the next one. And one other thing, you might think you're just one person and that your choice doesn't make a difference, but it makes all the difference. The fact is we're seeing a much worse wave than in other provinces, mainly because our vaccine coverage is just a few % lower. But we can close the gap, and we need your help to do it. So if you've been putting off getting vaccinated for whatever reason, now's the time. If you've gotten your first dose but haven't gotten around to the second, now's the time. And if you know someone who's hesitating, treat them with kindness and respect. Have a conversation and share the facts like those posted online at alberta.ca/vaccinefacts. But don't give up on each other. And there are two other reasons to act now. First, you have just a few days left till October the 14th deadline to get the $100 incentive for your first dose or your second. And second, a reminder that you're soon going to need 2 doses plus 14 days to access businesses and other venues participating in the REP. Right now, you only need to show proof that you're 14 days past your first dose. But on October 25th, that changes to 14 days past your second dose. So again, now is the time. In closing, we just celebrated Thanksgiving. So please show your appreciation of our healthcare professionals and each other by following health guidelines. I know we're all tired after 20 months of COVID-19 and tempers are short, and that's understandable. But I'm sad to say I continue to hear about healthcare workers facing abuse and harassment from some patients, visitors, or members of the public. Some visitors in hospitals have been verbally abusive to staff when asked to wear masks, and some public health inspectors have faced threats while carrying out their duties. So for those engaging in these behaviors, please, I ask you to stop and consider others. Our healthcare professionals and inspectors are doing their jobs, helping to keep us safe and treating people who are critically sick, and some are fighting for their lives. They deserve respect at any time, and now more than ever. So please keep that in mind and do your part to limit the spread of the virus and get us past this crisis. It truly is in your hands. I ask everyone to treat each other with respect and compassion, because remember, we will get through this, but we need to work together to do it, and we need each other more than ever to build the things we value in our lives, build the kind of province that we wish to live in for ourselves and for future generations. Thank you, and I'll turn it over to Dr. Hinshaw.
Thank you, Minister, and good afternoon, everyone. During the long weekend, we identified 1,085 new cases of COVID-19 on Friday, 1,039 on Saturday, 628 on Sunday, and another 606 cases on Monday. Our positivity rate ranged from 7.9 to 9.2% over the weekend, and yesterday was about 8.3%. There are currently active alerts or outbreaks in 464 schools. Of these, 13 schools are on outbreak. Over the last few days, we have seen an encouraging decline in the total number of active cases in Alberta. Our positivity rate is falling, and it has been below 10% since October 3rd. These are positive early signs that the growing number of vaccinated Albertans and our public health measures are having an impact. But I must caution that they are very early signs. We are not yet through this fourth wave and the effects that it continues to have on our healthcare system. As the Premier noted, there are currently 1,053 people being treated for COVID-19 in hospital, including 242 in ICU. While it's good news that COVID hospitalizations and ICU admissions appear to have plateaued, our numbers are still extremely high. We remain significantly higher than any other peaks during the course of the pandemic. In fact, we still have 148 more COVID patients in hospital than at the very peak of the second wave. Similarly, there are 59% more patients in ICU today than at the worst point in the third wave. Our case numbers, positivity rate, and many other indicators are as high today as they were in mid-May during the third wave. We have learned a lot about this virus, and we have seen that things can change for the worse in a hurry if we let up too soon. We are seeing some declines, but the virus is still spreading in our communities. Elective surgeries and procedures are still being cancelled or postponed. And sadly, people continue to die due to COVID-19. Since Friday, we have had an average of 8 new deaths per day reported to Alberta Health, with a total of 33 over the weekend. This includes the death of a 14-year-old who had complex pre-existing medical conditions that played a significant role in their death. I extend my deepest condolences to the loved ones of all of these individuals and to any Albertan who is mourning the loss of someone they cared about. If you know someone who is grieving right now, I ask that you reach out to them to let them know that they are not alone. Losses due to COVID and the protection of our health system are why we still need to do everything we can to limit the spread of this virus in our province. That includes following the public health measures in place, regardless of vaccination status or where we live. It also includes getting fully vaccinated and encouraging others around us to do the same. If you have a friend or family member who is an Albertan 75 years of age or older, who is a First Nations Métis or Inuit individual 65 years of age or older, who is a resident of a seniors congregate care facility, or anyone 12 years or older with an eligible immune-compromising condition, please encourage them to also book their third dose of vaccine today. If they need assistance making or getting to the appointment, please help them out. If you know someone who is hesitant to get the shot, share your own experience and reasons for being vaccinated and encourage them to speak to a healthcare professional. Each of these individual actions may seem small in the grand scheme of a global pandemic, but I assure you they are not. Added together, they are the difference between cases rising or falling. They are the difference between having to cancel surgeries or getting people the procedures that they need. They are the difference between saving lives or losing more Albertans to this virus. Thank you for all that you're doing every day to protect your communities. And I'll now ask Dr. Yu to provide an update on the health system.
Good afternoon. For the past 6 weeks, I've been worrying about the seriousness of the COVID-19 situation, particularly in our hospitals. We have never experienced anything like it before, with record numbers of patients needing critical intensive care and our frontline physicians and staff pushed to their absolute limits. Fortunately, due to the incredible work of our physicians and staff, we have managed to open enough additional ICU space to meet the unprecedented demand on our healthcare system that we experienced throughout the late summer and early fall. This past weekend, thanks to our friends in Newfoundland and Labrador, we were able to open 2 additional ICU spaces in Fort McMurray. So today, I'm a little bit more optimistic than I've been in quite a while. And in the spirit of Thanksgiving, I'm beyond thankful to all of you who took the public health restrictions seriously, and all of you who have gotten immunized as quickly as possible to help us combat this 4th wave. Because of you, we are seeing the pressures on our hospitals ease ever so slightly. In recent days, our ICUs have dipped below 80% occupancy when we include the surge bed numbers. And as of this morning, it was at 78%. But as noted before, this equates to 172% capacity if we don't include the 201 surge beds that we have created. So needless to say, the situation still remains extremely serious. The number of Albertans needing ICU care has fallen by a small amount in the past week. But it's still too early to suggest that this is a trend. But it's a good sign, and it's a faint silver lining to what has been a very difficult period for our healthcare system. These numbers suggest that the restrictions are working and that Albertans are doing their part. So please, let's keep going. The worst thing we can do now is to ease up. The slight let-up pressure on our hospital means that we have been able to slowly and carefully increase our surgical activity even more in the past 2 weeks. For example, 2 weeks ago, our surgical teams completed about 3,100 surgeries across the province, slightly more than 50% of our normal surgical capacity. And last week, we estimate that our teams performed about 3,500 surgeries, including more cancer surgeries. And we will continue to be cautious. And once again, I want to express my heartfelt apologies to anyone who has had their surgery postponed. If pressure in our hospitals continues to ease, we will be able to incrementally increase the number of surgeries we perform each day. Another reason why continuing to follow the public health restrictions and getting vaccinated is so important. I also want to reassure Albertans that the hospitals are safe to visit. If you need emergency care, our emergency departments are open and they are safe. If you think you need medical assistance, please don't delay visiting a hospital or other care options. I want to touch another aspect of our response to this 4th wave that has greatly impacted many Albertans. We continue to see many patients require a higher level of critical care from our regional communities where immunization rates are lower in these areas. We have the ability to transfer patients within our 5 zones and also out of each of the zones as needed to available acute care beds, including ICU beds. This is a benefit of a provincialized healthcare system, but is not without impact to those patients and families. Since September the 1st, about 290 Albertans have been transferred between zones due to the high number of patients needing COVID care, either in acute care or ICU. And this long weekend alone, 23 Albertans were transferred out of their zone. While the teams in North, South, and Central Zone were providing expert care to as many local residents as they can, we are typically transferring patients from the North, South, and Central Zones to Edmonton and Calgary, where we have created more additional ICU and acute capacity and where we have larger pools of staff. Interzone transfers are safe, but require specialized transport expertise and are only done when clinically appropriate. We're providing this information to be open and transparent and also encourage everyone across the province, and particularly in those communities with low vaccination rates, to be vaccinated. It is your best, safest option to avoid serious health outcomes, including being hospitalized with COVID-19. We're now well into the 20th month of the pandemic. Nobody would have predicted that COVID-19 would hold us in its grasp for this long or to this extent. And it's been exhausting for everyone, and we all long to return to a normal life. While some of you hopefully enjoyed a break over this past long weekend, our frontline care teams were caring for patients in our ICUs, in our acute care beds, in the COVID wards, in our emergency departments, and right across our health system. Our EMS crews were out there helping Albertans where they most needed it, and all of our health professionals were working tirelessly to care for patients. We deeply understand and acknowledge the stress and strain that they are under, as well as the impact that this is having on their families and loved ones. Alberta Health Services is committed to providing a safe, healthy, and inclusive work environment for all AHS employees, physicians, and volunteers. If you are struggling please reach out for help. Visit the AHS website for information on resources and supports that are available to all Albertans. AHS workers can find 24/7 support through the Employee and Family Assistance Program. For physicians, please contact the AMA Physician and Family Support Program. Both services offer help to help AHS staff and physicians navigate through life challenges, especially during the pandemic. We're starting to see some light at the end of the tunnel, and if we all continue to work together and do the right thing, the light will only get brighter. So please, let's follow the restrictions. Let's stay home if we feel unwell, and please get immunized as quickly as possible. Thank you.
Thank you, Dr. Yu. That concludes today's formal remarks for the press conference. We'll now move over to a media Q&A. Just a reminder to folks online and in person to please state who you're asking your question to. And for journalists who've joined us in person, please state your name and the outlet you're with. As I'm told, we have no one live in Calgary, and there's only two folks here in Edmonton. We'll start on the floor here before finishing on the phones. Go ahead, Michelle.
I have a question for Dr. Hinshaw. Dr. Hinshaw, there was some talk over the weekend about an order that you made allowing a symptomatic or COVID-positive patient to be in an AHS facility as a support person for a woman who is ready to have her baby. And I'm just wondering, how is this safe or in the best interests of the public to allow this to happen?
Thanks for the question. We have worked throughout the course of the pandemic to try to balance the direct COVID impacts with indirect impacts, and knowing that there are certain significant life events that people, for example, someone who's giving birth is needing support through. We had worked to try to figure out what a safe way could be with certain provisions, certain restrictions, and certain extra requirements that an individual would have to follow in order to be able to be present to support someone who was giving birth. Of course, given our current situation, we are looking at that again to determine if that's something that's still appropriate. And so that's something under review right now. We wanted to make sure again that we're trying to weigh all of the different components of, again, both direct and indirect impacts, but that was something that was put into place to facilitate support to someone in a significant moment in their life. It was not a routine, something that would be routinely offered, but in a particular circumstance, it could be offered as long as an individual agreed to use additional measures and precautions to protect those around them.
Thank you, Dr. Hinshaw. You can go ahead with your follow-up.
Some people would argue, Dr. Hinshaw, that losing a loved one to COVID-19 in a hospital is also a significant life event. And I'm wondering why that exception is not made for loved ones and family members of people who are dying in our ICUs.
Again, that's something that there can be specific case-by-case considerations made. We've been working with very closely with AHS and with visitor policies throughout the course of the pandemic and adjusting as needed. And so currently, again, we're working to make sure that we're looking at all of the processes and what might be required. And if that's, again, something that we identify as needing, again, those individual case-by-case exceptions, then that could be considered. We want to make sure, again, that we're balancing all of those different considerations of both direct and indirect harms, and it is under review.
Thanks, Dr. Hinshaw. We'll now take our last question from the floor here in Edmonton before jumping to the phones.
Oh, hi, everyone. It's François Gély with Radio Canada. I have a couple of questions for the Premier.
Go ahead.
OK, a couple of questions in French pour vous, Monsieur Kenney. Première question. On voit les chiffres, le nombre de cas commencer à diminuer. Ça semble être des bonnes nouvelles en ce moment, ce qu'on voit au cours des derniers jours. Est-ce que ça ne vient pas montrer que l'Alberta a trop tardé à mettre en place une forme de preuve vaccinale, un passeport vaccinal, comme certains l'appellent? Est-ce qu'on n'aurait pas pu s'éviter toutes sortes de problèmes dans les soins intensifs si on n'avait pas mis en place ces mêmes politiques-là en août, en septembre, comme l'ont fait les autres provinces?
I'll just summarize that in English for folks watching live who don't speak French. Basically, the question was, with the numbers coming down now, does that not suggest we should have introduced the REP earlier? So my response in French, écoutez, évidemment, nous avons vécu un taux de vaccination trop bas par rapport aux moyens canadiens. Heureusement, nous rattrapons avec l'augmentation des nombres des Albertains qui ont été vaccinés. Je crois que pour plusieurs raisons. Je crois qu'évidemment, le programme d'exemption a aidé, mais également les incitatifs, parce qu'on a vu une quart de million des Albertains qui ont décidé de recevoir le vaccin depuis le lancement en incitatif financier de $100 le 3 septembre. Mais également, je crois que, franchement, l'expérience de plusieurs communautés, particulièrement dans les régions rurales, avec les morts, avec la pression sur les hôpitaux, je crois que tout ça ensemble a mené vers une augmentation de taux de vaccination. Alors, comme toutes les provinces canadiennes, notre gouvernement était contre l'idée d'un passeport de vaccination au début pour plusieurs raisons raisonnables. Mais en bout de ligne, on a déterminé que c'était nécessaire de le mettre en place pour les activités, pour certaines activités. Alors, on va continuer d'étudier les résultats et modifier le programme si c'est nécessaire.
Any follow-up?
Yeah, and I'll ask in English if it's easier for everyone. Colleagues wants to know basically a question about the equalization referendum. Considering your low popularity, at least according to some polls, do you fear that it's going to essentially turn into a referendum into your own leadership instead of a referendum into the principle of equalization?
Oh, so I'll answer in English and French. Is that okay?
Sure, go ahead.
Okay. So, look, the referendum is on equalization, and really it's a symbol of whether we should have a fair deal in the Canadian Federation. This is something that we were elected on, a commitment to do this. We are keeping the commitment. And this is an opportunity for Albertans to say yes to a fair deal. It's not about partisan politics. There will be a provincial election in the spring of 2023. This is about whether or not Alberta should push hard to get a fair deal. I always say that we Albertans are generous. We are proud to be able to share some of our good fortune with other parts of Canada when times are good here and bad elsewhere. But we insist on having the ability to develop our resources and the prosperity that ends up being shared through programs like Equalization. That's what this vote is about. Alors, c'est un référendum sur la question de péréquation, mais plus profondément, c'est un référendum sur la justice pour l'Alberta à l'intérieur de la Fédération canadienne. Parce que les Albertains sont généreux envers le reste du pays, mais ils exigent que le reste du Canada, particulièrement le gouvernement fédéral, adopte les politiques qui nous permettent de développer nos ressources et notre prospérité économique pour que nous puissions partager nos richesses avec le reste du pays. C'est un engagement électoral clé d'avoir ce référendum le 18 octobre et c'est un engagement que nous gardons cet automne.
Okay, thanks for everyone who joined us in person today. We're now going to jump over to the phones. Operator, can you please put through our first caller?
Thank you. Andrew Lawton, True North.
Good afternoon. This question is for the Premier and perhaps Dr. Hinshaw as well. For the restriction exemption program and other restrictive measures that are in place, is there an off-ramp that's baked into this? Is there a point or a metric at which you think this program is no longer necessary that you can share either with case counts, hospitalizations, or simply vaccination rate?
Thank you, Andrew. The straight answer to that is no. We have not defined a particular criteria to end the program. I fully expect that we will have it in place through at least the first quarter of next year of 2022, because we are headed into an uncertain period. Even if we continue to see downward momentum in the case numbers and hospitalization numbers, even if we exit this fourth wave through the month of October, we will have to be on our guard as we go into colder weather, when people spend more time indoors. We will head into seasonal headwinds in terms of viral spread, and we will also maybe experiencing waning protection, both from naturally acquired immunity through prior infection and potentially through vaccines as well. The jury is still out on exactly when, but we do know that both of those kinds of immunity, from prior infection and from vaccines, can wane over time. So between weather, seasonal patterns, more indoor activity, and the potential for waning protection, we don't want to let down our guard, let's say in November, if we get out of this fourth wave, only to potentially face a Christmas spike or a winter spike. So I think we've just adopted the program. It seems to be working well. The businesses with whom I've spoken generally seem happy with it. Many of them say this is exactly what they wanted, and they thank us for having put it in place. I want to thank the vast majority of Albertans for cooperating with the program. It seems to have had at least some effect in helping to increase vaccination rates and therefore probably reducing case numbers and hospitalizations. So we think the program is working well. It will be in place at least until the first quarter of next year. We'll assess it then based on COVID trends here and around the world.
Thanks, Premier. I'm sorry, Andrew, do you have a follow-up?
Yes, I do. Thank you. We've seen in other jurisdictions, notably Israel, that at a certain point, 2-shot is not enough to be classed as fully vaccinated for their vaccine passport. I know Alberta has expanded the eligibility for booster shots. Is this a possibility that to be considered fully vaccinated for accessing all of these things under the restrictions exemption program, there could be a point at which 2 shots is not enough?
That's not where we're at now. So far, we continue to see very strong protection from the second shot, the 2-dose regime that we've maintained for the broad population. And as you know, 90% of our ICU patients with COVID are unvaccinated. So that's just a reflection of just how strong the vaccines have been here. But we will closely monitor the data. You've mentioned Israel. We have the advantage, we and countries around the world, of closely watching the Israeli experience to study the impact of their widespread application of booster shots to the population. So we'll be closely watching all of those trends. I won't rule out the possibility that if we find, over the winter, a significant decline in the protective effect of the vaccines, that we may very well receive advice from our advisory committee on immunization, as well as the National Advisory Committee on Immunization, for broader application of booster shots. So we'll cross that bridge if and when we come to it. I wouldn't rule that out, but it's not something that is under current consideration.
Thanks, Premier. Operator, can you please put through our next call?
Thank you. Shannon Johnston, CTV.
Hi there. This question is for Dr. Yu.
Whoops.
So, hello.
You can go ahead with the question. She'll hear it. Yeah.
As of today, Dr. Yu, schools are currently responsible for contact tracing. When exactly will AHS take over this task?
Well, we've never stopped contact tracing. What we did was that over the summer there was a bit of a ramp down, and so there were some reductions in the FTEs, but currently right now we have over 1,000 FTEs for contact tracing, targeting that we can cover about 2,000 positive cases per day. With the announcements of the increased need for contact tracing in schools last week, we are in the process of actually hiring additional staff to help us manage the increased contact tracing for the schools.
And Shannon, do you have a follow-up at all?
I do, actually. This is actually for the health minister. Dr. Yu is saying that there will be more staff brought in. Will there be any other supports offered to schools in the form of money?
So you broke up a little bit. I just heard the last part of the question is any other supports offered in the form of money. Is that correct?
Correct.
Yeah. Yes. Well, thank you. So Minister LaGrange may be able to get into more detail on this, but my understanding is that school authorities have had access to over $1 billion in taxpayer funding for COVID-19. This includes $120 million increase in operating funding, $250 million in accelerated capital maintenance and renewal funding, and access to taxpayer-funded board reserves, which are actually higher than prior to COVID. On top of that, Budget 2021 provided school divisions with $130 million in COVID-19 mitigation funding.
Thank you, Minister. With that, operator, can you please put through our second last caller?
James Keller, Globe and Mail.
Hi there. A question for the Premier. Back to the equalization referendum. What result are you looking for to give yourself a mandate to demand some changes or concessions from the government? Is it 50% plus one? Are you looking for a higher proportion of support? Tell me a bit about that.
Yeah, well, we're looking for a yes vote, yes for a fair deal, and we're looking for a majority that's over 50%. So this is something we committed to in the last election. It was a key campaign commitment. We're keeping it. It's a chance for Albertans to send a message that while we are proud of supporting our fellow Canadians, we need the ability to develop our economy. And this is a message to Ottawa to back off policies like Bill C-69, the No More Pipelines law, Bill C-48, the tanker ban, the pipeline cancellations, and other policies which are inhibiting our ability to develop the wealth that we share with fellow Canadians. So this is something I think Albertans have long wanted to speak to. We consulted widely through the Fair Deal panel in the fall of 2019, and the strong recommendation was to proceed with this electoral commitment. Albertans will have their say on October the 18th, and whatever their views are, I urge people to go out and vote in the municipal elections, school board elections, Senate elections, and the two referenda.
Thanks, Premier. James, you can go ahead with your follow-up.
Definitely. So in terms of what the province wants out of all of this, I know, earlier, last week or so, you said, well, not necessarily getting rid of the program, it's a bargaining tool, but when it comes to either renegotiating the formula or some sort of constitutional change, like what specifically does Alberta want as an end result out of all of this? I mean, it sounds like you want some political pressure on pipelines, but do you actually want changes to the equalization program?
Oh, yes, we certainly do. And our position has been clear on this for at least 4 years since I campaigned on this commitment in 2017 during my party's leadership campaign, and then it was, of course, formalized in the 2019 election platform. And this is based on the precedent of the Quebec secession reference of the Supreme Court of Canada from, I believe, 2008, which said that if a province holds a referendum on a constitutional amendment and a majority votes in favor, that the federal government then has an obligation to negotiate that matter in good faith with the province. So this is our effort to get Ottawa to take Alberta's demands seriously, one of which, of course, is a fairer equalization formula, one that would address the inequity around natural resource revenues, that would put a cap on the automatic escalator of payments, and look at other reforms to make the system more fair. At the same time, one way Ottawa can address that unfairness would be to offer us full retroactive compensation under the fiscal stabilization program, which I call a kind of reverse equalization for so-called have provinces when they have catastrophic declines in revenue, as we did in the last couple of years. That would be worth an additional roughly $4 billion to Alberta. But it's also an opportunity for us to underscore the deep frustration of Albertans with policies that have damaged our economy and our ability to generate the revenues that are shared through fiscal federalism, including the equalization program. So that would be, issues like guaranteeing the timely completion of the Trans Mountain expansion, repealing or fundamentally changing the new Canada Environmental Assessment Act, and the tanker ban.
Thanks, Premier. Operator, can you please put through our last caller of the day?
Bill Hoffman, Post Media.
Yes, this is for Premier Kenney. It appears the gift card vaccine incentive is going to cost at least $15.2 million. And given that the REP appears to have been much more effective, do you think that's been a good use of taxpayer money?
Well, yes, absolutely. Every little bit that contributes to higher vaccination rates is a good use of taxpayer money. Everybody who's registered for that program, if you say it's now 15 million, that would be 150,000 people registering for it, which is a little more than half of the increase in vaccination that we've seen since September the 3rd. We did see a definite uptick in vaccination rates following the September 3rd announcement of the $100 incentive. And I know anecdotally about many reports of people, particularly younger people, who finally decided to get the jab so they could receive that bonus payment. So I think it's all of these things together. It's not just one effort or another. It's the lottery that we announced in the summer led to an uptick in rates. The $100 incentive led to an uptick in rates. The REP led to an uptick in rates. And I think, quite frankly, the huge pressure on our hospitals and increase in fatalities recently caused a lot of people who've been skeptical about the vaccines to think about it twice. So it's hard for us to kind of disaggregate which factors have caused people to make these decisions, but I do think the financial incentive is just one extra reason for people who have been hesitant to get vaccinated. And I'll also point out that what we've seen in many jurisdictions is that the lowest vaccination rates have often been correlated to folks in living with lower incomes, and those are people who have multiple barriers. In some cases, they may not have a vehicle, hard to get around town. They may not know about that will pay for their ride share or their taxi to a pharmacy to get the shot. This gives them that incentive. If there might be people living with low incomes in very remote rural areas, and it might cost them, $50 to fill up their gas tank to get into town to get the shot. And this helps to offset those costs. So it's just a little bit of a small way of perhaps helping some low-income people with multiple barriers to get the shot as well.
And your follow-up, Bill?
Sure. Premier Kenney, what do you make of the NDP's call for an all-party committee to review what they were calling your government's bungled handling of the fourth wave?
This is, look, we'll be obviously having a comprehensive review of every aspect of Alberta's COVID response. When this is all said and done, I think we should wait until we are fully past COVID and clearly into the endemic phase, and so that we can take a look at the entire picture, because we don't yet know what's ahead of us. I don't think it is a use with there's so much pressure on our health officials right now coping with the current wave. I don't think it would be terribly useful to add onto their 18-hour days a retrospective review of what we're going through right now. So there'll be plenty of time for the legislature, for external bodies to come in and do a comprehensive review and lessons learned. But right now, I think we need all hands on deck focused on the immediate challenge that we're facing.
All right, thanks, folks. That wraps things up today.
Thank you very much.